starting from the 21st of April, next Thursday, we will start with the first phase of relaxation. And they are in relation to CAP 599F, Prevention and Control of Disease Requirement and Directions. We resumed the nighttime dine-in service and reopened the scheduled premises. In terms of 599G, we relax the gathering in private places, and in order to measure up to public wishes to resume a normal life. Because of the transmissibility of Omicron, I hope to stress that in relaxing the social distancing measures, the scheduled premises have to fulfill all the infection control and prevention measures, and they should try to stop the spread of the virus. Over the past 2 years, we have introduced a whole string of measures that have been serving us well, like the number of people, the capacity limit, and also the vaccine pass, which has been recently introduced, the wearing of face mask, the use of Leave Home Safe app, and temperature screening, the provision of sanitizing hand rubs, and so on. Now, there is also the requirement of the air change on premises. For the specific restrictions, now for the restaurants, F&B premises, first, the nighttime dining will be extended to 10 p.m., and nighttime dining will be allowed. Second, patrons per table will be increased from 2 to 4. Third, for a banquet, we allow no more than 20 people. And fourth, bars and pubs will continue to be closed. Since we have to introduce the infection control and prevention measures, all staff members before entering the premises will have to undergo an RAT test every 3 days. For the scheduled premises, the sporting venues will be reopened, the indoor and outdoor venues, the fitness centers, beauty parlors, and massage parlors, the performing venues, theme parks, museums, cinemas, and the billiard rooms, the bowling alleys and skating rinks, and amusement game centers, and also the religious places. They will all be reopened. Now, for these scheduled premises that will be reopened, we have the capacity limit of 50% and group gathering of no more than 4. We allow team-based sporting events. For dining, for eating, and for the beauty parlors and places of worship, people will have to wear face masks in these premises. Earlier, in the anti-epidemic kit, we have provided the KN95 kit face masks, and if people are wearing the face masks, they have to be tight-fitting. If they're not tight-fitting enough, they have to wear 2 masks. These are according to the experts' advice. Also, in relation to vaccination, the patrons at the cinemas will be allowed to eat and drink. And there are 2 requirements there. First, in terms of the staff members of the cinemas, they have to have 3 shots of vaccines, or they must have the exemption, medical exemption, or they must be recovered patients with 2 shots. Second, all the patrons will need to have 3 shots of vaccines, except for children under the age of 12 or recovered patients over the past 3 months. If they have 2 shots, they would be regarded as fulfilling the entrance requirements. And also under 599G, starting from the 21st of April, we will lift the mixing of 2 households in private places. And this multi-household restriction will be lifted. And next week, we will be submitting proposals to the EXCO to relax the group gathering ban limit from 2 to 4. Yesterday, you probably noticed that the SCED mentioned that the local tour of no more than 30 people will be resumed on 2 conditions. First, the staff members must have 3 shots of vaccines. And on the day of the trip, they have to undergo RAT test. Second, all the tourists will have to fulfill the prevailing requirements under the vaccine pass regime. On the day of the trip, all travelers will have to undergo the RAT. If they test negative, then the number of people can be relaxed to no more than 100. We will also extend the public transport arrangement and public places arrangement in terms of wearing face mask. All these measures that we announced, as the chief executive said, will ensure that we will be able to relaunch our society and relaunch economic activities and put ourselves back on the way to a normal life.